So a couple of patients, in fact 3 patients in the past couple of weeks have called up who have been in excruciating pain, and they've wondered whether or not they should go to A&E. Now, most of the time, when you're in severe pain, you shouldn't really be going to A&E, because although I understand that you're panicking, I understand that you're in a lot of pain, if you go to A&E, they're unlikely to have the resources or the individuals to thoroughly test you. You're more likely going to just be given ease of mind and their peace of mind, and as well as that, given some medication that you could have got over the counter, or you could have just waited to visit a medical practitioner the next day. But just in case you have the following symptoms, this is when you should definitely go to A&E with back pain. So the first is that since the onset of your back pain, you've had pain going down into both legs with compromised nerve supply to your legs. So this could look like you tripping over your feet, you not feeling anything touching your legs. All of these indicate that you might have had a central disc prolapse in your lower back, and this can be a medical emergency if you also have the following symptoms, which is you have compromised ability to go to the toilet. Now traditionally, normally this can be urinary retention, so where you can't go for a number 1, but you might experience leaking, where your bladder is so full. This can also provide bloating, but also if you have fecal incontinence, so you can't help but go for a number 2. Now these don't have to be strict, they can be incomplete. So for women, incomplete urinary retention can often can often lead to recurrent UTIs, because you can't fully empty your bladder, because often the disc prolapse in your back is pressing on the nerves that go to your bladder. That can also be a sign of a medical emergency. The other is if you are unaware when you're going to the toilet. So you can control it, but you're quite unaware when you're going. And then also if the area that you wipe, so your saddle area, if you experience numbness in this area. Now these are all signs of Cauda-Equina syndrome. They are classed as a medical emergency, and it's important that you stress these symptoms when you do go to A&E if you have them. If you don't have these symptoms, especially if you just have pain, don't worry. A lot of the time this pain will pass. The best thing is to call 111, and then also if you want to, you're more than welcome to call the clinic, to Revitalise Clinic, where any of us over the phone will have a conversation with you and explain to you what's best. So this video is mainly to advise you so you know when to worry or when not to worry. All of these symptoms are in the absence of trauma. So if you had trauma, for example, if you fell from a height and you had severe back pain, that's when you might suspect a fracture, especially if there's night pain associated with it, or pain in the absence of movement. But this video is just to give you some peace of mind and some guidance on what to do to make sure that you make the best use of your time and also the potential medical practitioner's time that you'll be seeing. But if you have any questions and you want to run through your questions with us, just call us on 01474 356 284, or visit our website and book an online free consultation at www.revitaliseclinic.co.uk.